Hello everyone, we are the Health Informatics Project Management Group, and this is our presentation on the MAGI scripted advice response prediction to citalopram based on patient medical history. Introduction. According to the National Institute of Mental Health, major depressive disorder or major depression is the most common mental disorder in the United States, affecting 8.3% of adults in 2021. The most common medication used for this condition are SSRI medications or selective serotonin reuptake inhibitors, which functions to increase serotonin levels in the brain. To help in predicting the effectiveness of certain medications, in this case the effectiveness of citalopram in patients with depression, an AI system was produced called Medical Artificial General Intelligence or MAGI. This system reduces errors by removing irrelevant information and using diagnoses, outcome, and treatment codes to provide a more accurate information. In this case, within the MAGI database, SQL was used to calculate/predict the effectiveness of citalopram in patients with a history of cysts, cornea testing, and anesthesia procedures.
Let's go over our methods. To begin, we connected to our source, the MAGI database sample knowledge base 1. We wanted to filter to isolate our 4 target concept codes. We then dropped any existing temporary tables to avoid conflicts or duplication, which is essential for script reusability and clean execution. Next, we filtered the data to only include rows where both the concept code and the target concept code matched one of the 4 key concepts: citalopram response, tailbone cyst, cornea thickness, and anesthesia. This filtering allowed us to focus solely on the interactions between these specific clinical events. Using SQL case statements, we mapped codes to their corresponding names to make it easier to identify the terminology. We used the select into statement to output all of this processed data into a new temporary table called isolation table. We renamed the columns to make the results cleaner and more intuitive. For example, instead of using ambiguous names like N-code, we used code number. The dataset was sorted by target concept code and concept code to organize the relationships for better readability and easier validation. Now let's go over our analysis and calculations. Here we have a 2-node example from MAGI. A 2-node analysis examines the relationship between 2 concepts, such as a diagnosis and a treatment, or 2 diagnoses. For example, tailbone cyst and anesthesia, or anesthesia and the patient's response to citalopram. If these frequently appear together, it might count as a co-occurrence. The purpose of a 2-node analysis can help determine if there's a statistical association between the 2 clinical identifiers. A 3-node analysis involves the interactions of 3 distinct concepts, which could include sequences or several conditions simultaneously occurring in a patient's file. The purpose is to explore for complex relationships. The example we have here references a 3-node network from MAGI, and the example given is citalopram response, tailbone cyst, and anesthesia. All node analysis considers all the possible concept nodes in a full set of medical concepts, analyzing the whole network of possible concept relationships. It can reveal an entire network of code relationships. An all-node analysis is useful for deep learning, network inference, or clustering. Direct effect measures the immediate association between 2 concepts but excludes indirect pathways. This can be critical in causal inference to understand which relationships are not simply byproducts of other variables. For example, if citalopram response is directly affected by tailbone cyst without medication by another condition, this is a direct effect. We use these formulas to calculate the direct effects for non-occurrence of variables. Log odds stands for logarithm of the odds ratio. Using this formula measures the strength and direction of association between 2 binary outcomes. Positive outcome means an increased likelihood, negative means decreased likelihood, and 0 means no effect. This can be used in a logistic regression model.
In this slide, we present the results for patients with a history of undergoing an anesthesia procedure. Among these patients, the probability of responding to citalopram was only 7.4%. This suggests the prior exposure to anesthesia may be linked to factors that reduce the effectiveness of treatment. Here we look at patients who did not undergo an anesthesia procedure in their history. Their probability of responding to citalopram was 34.6%, which is significantly higher than the 7.4% seen in patients with an anesthesia history. These are the results for patients with a tailbone cyst. Their response rate was just 7.3%. This indicates that the presence of a tailbone cyst may also be associated with reduced responsiveness to citalopram treatment. Comparatively, patients without a tailbone cyst had a much higher probability of response at 36%. In this group, the probability of responding to citalopram was lower at 12%. This suggests that the presence of cornea thickness may be associated with a reduced likelihood of a positive treatment response. Among patients who do not have cornea thickness, the probability of responding positively to citalopram treatment increases to 36.1%. This suggests that the lack of cornea thickness as a factor may be associated with a higher likelihood of therapeutic response. In conclusion, this table summarizes the results from our analysis of anesthesia, tailbone cysts, and cornea thickness, and their associations with response to citalopram in patients treated for depression. Tailbone cysts showed the strongest negative association with a coefficient of negative 1.968, followed closely by anesthesia at negative 1.889, and cornea thickness at negative 1.422. These negative coefficients indicate that the presence of each condition significantly decreases the likelihood of a positive treatment response.